Protocols for a service reflect what they think that it's important for providers to understand about the disease processes that they see in the field. So if a service doesn't have a sickle cell protocol, then that service doesn't think it's important for their providers to see sickle cell as a very unique and complex disease. So without that protocol, sickle cell disease is seen as primarily a pain problem, and they are treated under a pain protocol. And that may be the most concerning presenting problem for the patient, but it isn't the most concerning presenting problem as far as sickle cell disease and sickle cell disease crisis. It's a perfusion issue, a very serious perfusion issue, and it's affecting multiple systems and vital organs. And mortality and morbidity is very high with sickle cell disease, despite the fact that a lot of people think that it's a made up disease. I've heard people say that constantly throughout my 20 years in healthcare. But when's the last time you met someone with sickle cell disease who experiences sickle cell disease crisis, who lived past the age of 50? The average lifespan for someone with sickle cell disease is between 40 and 50 years of age, which is why we need sickle cell protocol, so people see it as a comprehensive disease and not just a pain problem. These patients need all sorts of support. And yes, they do need pain support, aggressive support, more than just those restrictive protocols that grant either a single administration of 50 micrograms of fentanyl or require the provider to call medical control and ask permission to give them pain medication. They need aggressive analgesia. They need respiratory support. Often they need positive pressure like CPAP or BiPAP. They need appropriate amounts of fluid administration. The disease needs to be seen as a complex and comprehensive disease and not just a pain problem. And I will develop a series on this and do a podcast on it so we can increase our education on this.